Histology of endocrine glands. So we need to discuss about four slides. One is pituitary gland, thyroid gland, parathyroid gland, and suprarenal gland, otherwise called as adrenal gland. Coming to the pituitary gland, we know that in the pituitary gland we have pituitary gland divided into anterior pituitary as well as the posterior pituitary. And in the anterior pituitary, we will able to see chromophores and chromophil cells are present. Out of these chromophil cells, we have eosinophil cells are present as well as basophil cells are present. So, eosinophil cells, they are represented with blue color, and the basophil cells, they are represented with red color. Eosinophil cells they are represented red color, and basophil cells are represented with blue color. So it consists of cells are present. Eosinophil cells as well as the basophil cells are present. In between the So these are the eosinophil cells, and the blue ones are the basophil cells. Okay, so the eosinophil cells are, we have already discussed under gross anatomy of hypophysis cerebri, somatotrophs and mammotrophs. And basophil cells are gonadotrophs and thyrotrophs and corticotrophs. Okay. So we know that we have detail explained regarding the what are the hormones secreted by the somatotrophs under the gross anatomy of the histology of under the gross anatomy of hypophysis cerebri. For brief, somatotrophs secrete growth hormone, mammotrophs secrete prolactin, gonadotrophs secrete follicle stimulating, luteinizing and ICSH, follicle stimulating hormone, luteinizing hormone as well as interstitial leading hormone. Thyrotrophs, basophil cells are thyrotrophs, they secrete TSH, and corticotrophs, they secrete ACTH. Okay, so that's about the hormones secreted by the chromophil cells. And in the posterior pituitary, we can't see any eosinophil cells or basophil cells cannot be seen in the posterior pituitary. We will able to see some unmyelinated nerve fibers are seen in the posterior pituitary. Some unmyelinated nerve fibers are seen in the posterior pituitary. Along with the unmyelinated nerve fibers, we will see some cells. Some cells are present along with unmyelinated nerve fibers are seen in the posterior pituitary. Unmyelinated nerve fibers are seen. Along with the unmyelinated nerve fibers, we will be able to see some cells which are nothing but the supporting cells. We call these cells as pituocytes. Okay, and that's about the posterior pituitary. Posterior pituitary, it acts as a storehouse for the two hormones, that is nothing but ADH as well as oxytocin. Okay, we know that the ADH and oxytocin, they are secreted by, they are synthesized by the supraoptic as well as the paraventricular nucleus. So the anterior pituitary consists of eosinophils and basophil cells, and the posterior pituitary consists of unmyelinated nerve fibers, and along with the unmyelinated nerve fibers, you will able to see some pituocytes. Okay, so that's about the histology of the pituitary gland. And coming to the histology of the thyroid gland. So, coming to the histology of thyroid gland. Coming to the histology of the thyroid gland, we know that thyroid gland is covered by a capsule. Okay, thyroid gland is covered by a capsule, and this capsule divides the gland into more number of lobes and lobules. So the thyroid gland, it is covered by a capsule, and this capsule divides the gland into more number of lobes and lobules. Okay, so in the thyroid gland we will able to see the sections of thyroid follicles are present. So what is the structure of thyroid follicle? So thyroid follicles consists of surrounded by cuboidal epithelium. Surrounded by thyroid, structure of thyroid consists of cuboidal epithelium. The thyroid follicles, they are lined by the cuboidal epithelium. The thyroid follicles, they are lined by the cuboidal epithelium. Okay, and the epithelium may vary depend upon the activity of the gland. For example, if the gland is in moderate activity, the follicular cells which are surrounding the thyroid follicles, they are of cuboidal. Okay, if this is the thyroid follicle and the cells surrounding the thyroid follicles, we call them as follicular cells. Okay, so the cells surrounding the thyroid follicles, we call it as follicular cells, which are cuboidal during moderate activity. So in moderate activity, the thyroid follicular cells, they are cuboidal. If the gland is highly active, then what is the structure of follicular cell means? They become columnar. If the gland is highly active, the follicular cells, they are lined by columnar cells instead of cuboidal cells when the gland is highly active. Okay, so when the gland is highly active, the follicular cells become columnar. When the gland is moderate active, the follicular cells are cuboidal. Okay, and when the gland is inactive, the follicular cells are flattened cells. When the gland is inactive, the follicular cells become squamous. So, depend upon the activity of the gland, the shape of the follicular cells vary. When the gland is moderate active, the follicular cells are cuboidal. When the gland is highly active, the follicular cells are columnar. When the gland is inactive, the follicular cells become squamous. Okay, and this is the follicular cavity. In between the follicular cells, we have a cavity that is called follicular cavity. The follicular cavity consists of colloid. In highly active stage, the follicular cell consists of very less amount of colloid. So this is called colloid. Okay, this is called colloid. And when the gland is highly active, the colloid is very much less. When the gland is moderate active, the colloid amount is also moderate. When the gland is inactive, then the colloid amount is more. We have colloid is more. More amount of colloid is present when the gland is inactive. When the gland is highly active, the colloid it is very less or scanty. When the gland is moderately active, the colloid amount is also moderate. Okay. So the thyroid gland consists of thyroid follicles. These follicles, they are lined by the follicular cells. So these are the thyroid follicles. Okay. This is the thyroid follicles. In between the thyroid follicles, we have polyhedral cells are present. And then we have polyhedral cells are present. These polyhedral cells are called as C cells. These polyhedral cells, we can call them as C cells. These C cells secrete thyrocalcitonin. These C cells secrete thyrocalcitonin. Okay, when we take the thyroid follicles, so we know that the thyroid gland releases the hormones T3 and T4. So the thyroid gland, the thyroglobulin, this colloid we call it as iodinated thyroglobulin. This colloid we call it as iodinated thyroglobulin. This colloid we call it as iodinated thyroglobulin. Okay. So what happens is here the thyroglobulin, it is synthesized by the endoplasmic reticulum. This thyroglobulin, it is synthesized by the endoplasmic reticulum present in the follicular cells. Again, this thyroglobulin, it is packed by the Golgi apparatus and it is thrown into the lumen of the nothing but follicular cavity, and it is thrown into the follicular cavity by exocytosis. Okay, and here in the follicular cavity, this thyroglobulin combines with the iodine to form iodinated thyroglobulin, nothing but the colloid. Iodinated thyroglobulin, otherwise called it as colloid. Okay, so the thyroglobulin, it is synthesized by the endoplasmic reticulum. Okay, again this thyroglobulin, which is packed into vesicles, by the Golgi apparatus, and this by the Golgi apparatus they thrown out into the follicular cavity by exocytosis, and here this thyroglobulin combines with iodine and forms the iodinated thyroglobulin, which is called as colloid. When there is a need to release of hormones T3 and T4, what happens here is this iodinated thyroglobulin again taken up by the follicular cells through endocytosis. And by the action of the enzymes produced by the lysozymes, they are converted into T3 and T4 and they are released into the blood. Okay. So the T3 and T4 are formed when the iodinated thyroglobulin again absorbed by the follicular cells by endocytosis, and by the action of the lysozyme present in the follicular cells, these iodinated thyroglobulin, it divides into T3 and T4. T3 we call it as triiodothyronine and T4 we call it as thyroxine. Okay, that's the release of the hormones from the follicular cells. And coming to the C cells, which are present in between the follicular cells, and also they may present between the follicular cells and the basement membrane. These C cells are called it as parafollicular cells. They decrease the serum calcium level. What is the function of C cells is they decrease the serum calcium level by inhibiting the bone resorption. They decrease the serum calcium level. Okay, so that is the function of the C cells or parafollicular. The C cells or parafollicular cells, that's they are present in between the follicular cells. Okay, so that's about the thyroid gland. Thyroid gland divides into lobules. And by the capsule it divides the gland into more number of lobes and lobules. In each lobule we will be able to see the thyroid follicles, and the thyroid follicles are lined by follicular cells which may be cuboidal, squamous as well as columnar depending on the activity of the gland. In the follicular cavity we have iodinated thyroglobulin is there. This iodinated thyroglobulin again taken back by the follicular cells and they release T3 and they manufacture into T3 and T4 and they released into the blood. These C cells they secrete they decrease the serum calcium level. They are present in between the thyroid follicles and sometimes they may present between the basement membrane and the follicular cells also. So that's about the thyroid gland. Okay. And coming to the parathyroid gland. Coming to the parathyroid gland. Parathyroid gland situated, there were 4 parathyroid glands present on. There are 4 parathyroid glands present on the thyroid gland. They are present on the back side of the thyroid gland, superior parathyroid as well as the inferior parathyroid. This superior parathyroid as well as the inferior parathyroid, when we take the structure of thyroid gland, it consists of cords of cells. Separated by sinusoids. It consists of cords of cells separated by sinusoids. These cells are of two types, chief cells as well as the oxyphil cells. Chief cells as well as the oxyphil cells. Oxyphil cells are comparatively larger when compared to the chief cells. These chief cells secretes parathyroid. These chief cells secretes parathyroid, which is exact the opposite effect of the thyroid gland, which is exact the opposite effect of the C cells. They increase the serum calcium level. These C cells, they increase the serum calcium level by increasing the bone resorption. Okay. So in the parathyroid gland, when we take the parathyroid gland, the cells are arranged in cords. And there are two types of cells are present, chief cells and oxyphil cells are present. These chief cells secretes parathyroid, and these chief cells increase the serum calcium level, exact to the opposite of the C cells which are present in the thyroid gland. So that's about the parathyroid gland. And coming to the suprarenal gland. So suprarenal gland, or we can otherwise call it as adrenal gland, they are present on the upper pole of kidney. The suprarenal gland has cortex and medulla. And these suprarenal glands, they secrete glucocorticoids, mineralocorticoids, and the adrenal medulla secretes epinephrine and norepinephrine. Okay. So coming to the cortex, the suprarenal gland consists of cortex and medulla. Okay. Suprarenal gland consists of cortex and medulla. The suprarenal gland, it is covered by a capsule. So the cortex consists of three zones: zona glomerulosa, zona fasciculata, and zona reticularis. When we take the zona glomerulosa, the cells are arranged in inverted U shape. Separated by the sinusoids. The cells are arranged in inverted U shape. In between the nucleus is present here. The cells are arranged in inverted U shape in the zona glomerulosa and separated by a narrow sinusoids Okay. And coming to this is the zona glomerulosa. And coming to the zona fasciculata, the cells are arranged in cords. That means the cells are arranged in 2 to 3 rows. The cells are arranged in 2 to 3 rows. The cells are arranged in 2 to 3 rows. So this is separated by narrow sinusoids. Sorry, I have represented with red color. Separated by narrow sinusoids are present. And in between the cells we have nucleus is present. Okay, so in the zona fasciculata, the cells are arranged in cords. Zona fasciculata, the cells are arranged in cords. And coming to the zona reticularis, here the cells can branch and anastomose with each other. Here the cells can branch and anastomose with each other. These cells can branch and anastomose with each other. That's why the name reticularis. Okay, the cells can branch and anastomose with each other. This is zona reticularis. This is about the cortex. Cortex consists of 3 zones: zona glomerulosa, zona fasciculata, and zona reticularis. And coming to the medulla, medulla consists of groups of cells medulla consists of groups of cells these groups of cells, they are nothing but the medullary cells, they are nothing but the modified postganglionic sympathetic neurons separated by wide sinusoids, separated by wide sinusoids, separated by wide sinusoids. Okay. So, what are the hormones? So, zona glomerulosa, zona fasciculata and zona reticularis, these constitute the cortex, and the medulla consists of postganglionic sympathetic neurons, nothing but the group of cells, they are arranged in they are arranged in groups, the cells are arranged in groups, they are nothing but the postganglionic sympathetic neurons, postganglionic sympathetic neurons. Okay, so what are the hormones secreted by the zona glomerulosa? Zona glomerulosa secretes aldosterone. Zona glomerulosa secretes mineralocorticoids. They are aldosterone and deoxycorticosterone. Aldosterone and deoxycorticosterone. Aldosterone and deoxycorticosterone, they maintain the water and electrolyte balance of the body. And zona fasciculata secretes glucocorticoids like cortisone and cortisol. Cortisone and cortisol, it also secretes dehydroepiandrosterone. Dehydroepiandrosterone. So, zona glomerulosa secretes aldosterone and deoxycorticosterone. Zona fasciculata secretes cortisone, cortisol and dehydroepiandrosterone. And zona reticularis secretes both mineralocorticoids, both glucocorticoids as well as sex hormones, that is androgens and androgen. It also secretes sex hormones. It secretes glucocorticoids as well as the sex hormones. Okay, so zona glomerulosa cells, the cells are arranged in inverted U shape separated by narrow sinusoids. In zona fasciculata, the cells are arranged in 2 to 3 in number. In zona reticularis, the cells they can branch and anastomose with each other. And zona fasciculata, then coming to the zona medulla, it consists of postganglionic sympathetic neurons separated by wide sinusoids. The medulla secretes epinephrine and norepinephrine. It secretes epinephrine. These hormones released during extreme emotions like fear and anger. These hormones released during extreme emotions. During fear and anger, these hormones release. Okay, so that's about the various hormones secreted by the adrenal gland. Okay, so or suprarenal gland. So that's about the adrenal gland or suprarenal gland. And now we will discuss about liver and pancreas. And now we will discuss about liver and pancreas. Okay, liver and pancreas. So coming to the liver, so liver it is covered by a capsule. Liver, it is covered by a capsule that is called Glissen's capsule. The capsule which covers the liver, we call it as Glissen's capsule. And in the liver, we will able to see, when we take this section of liver, we will able to see hexagonal lobules are seen. When we take the liver, hexagonal lobules are seen. Hexagonal lobules are seen in the liver. Okay. And in the center of each lobule, we will able to see one vein, that is nothing but the central vein. We can mark the central vein with blue color. We know that the veins are usually in blue color. So on the center of each lobule, we will able to see vein that is called central vein. Here in the liver, the cells are arranged in cords. The cells are arranged in cords. That means the cells are arranged in rows. Okay. When we take one hepatic lobule, here the cells looking here, look at here, the cells are arranged in rows. That is called hepatic cords of cell is seen in the each lobules of liver. Hepatic cords of cells are seen in the each lobule of liver. Hepatic lobules are seen and hepatic cords of cells are seen in each lobule of liver. And at the periphery of each lobule, we will able to see, at the periphery of each lobule, we will able to see a branch from the hepatic artery and a branch from the portal vein and hepatic ductule is seen. So these three together form the portal triad. These three together form the portal triad. So when we take the structure of portal triad, we can see a branch from the hepatic artery, a branch from the portal vein and a bile ductule is seen. These together form the portal triad. Okay, and these separated by a space, these three structures, they are separated by a space. We call it as space of Mal. Space of Mal. This is hepatic arteriole. Hepatic arteriole. This is portal venule. A branch of the portal vein, we call it as portal venule, and this is bile ductule. These three structures together forms the portal triad, which are present at the periphery of each lobule. So the portal triads, they are present here also, here also, here also, here also. Okay, the portal triads are present in each hepatic lobule. Okay, now these hepatic lobules, they are arranged in hexagonal in shape, and the liver cells, they are arranged in cords. Okay, see here, when we take one hepatic cord, and this is the second hepatic cords of cells, this is the space present here, and this space is occupied by the sinusoids. This space occupied by the sinusoids. Sinusoids are nothing but they are arranged, they are lined by fenestrated. They are lined by fenestrated cells. They are nothing but fenestrated blood capillaries. They are lined by fenestrated blood capillaries. It consists the epithelial cells have gaps in between them. So the sinusoids consists of epithelial cells having some fenestrations. Okay, now this is nothing but one sinusoid consists of having some fenestrations. So the blood from the portal venule hepatic artery, it passes through the hepatic sinusoids. Here what happens is the liver cells comes in direct contact with hepatic sinusoids. Thus it is able to screen all the substances present in the portal vein. Thus it is able to screen all the substances present in the hepatic artery, portal vein as well as the bile duct. Okay, na? So the liver cells, it acts as it screens all the substances which are present in the comes into the hepatic sinusoid, that is nothing but the blood from the portal vein and blood from the hepatic artery as well as the bile ductule. Okay, these hepatic sinusoids, they open into the central veins, and these central veins together forms the hepatic veins. These central veins together form the hepatic veins. Okay, so that's about the sinusoids and as well as the hepatic cords of cells. Okay, and the space between the sinusoidal surface and the hepatic cords of cell, we call it as space of Dissay. Space of Dissay. Space of Dissay is nothing but a gap between the hepatic cords of cells as well as sinusoids. This space we call it as space of Dissay. Okay, and next one is the hepatic artery. It passes along the connective tissue septa, which connects the two lobules. This hepatic artery, which connects the it passes along the connective tissue septa. So if you take, this is one hepatic lobule and this is another hepatic lobule. This hepatic arteriole, it passes between the connective tissue septa between the two hepatic lobules. Okay, and one more thing is what is portal lobules? We know that these are hepatic lobules. What is portal lobule means? The structures present in the portal triad. The structures present in the portal triad. The structures present in the portal triad, they supply the three consecutive lobules. They supply this lobule, they supply this lobule, and they supply this lobule. So they supply three consecutive lobules, and this lobule, this pyramidal shaped, that inverted pyramidal shape, this pyramidal shaped one, we call it as portal lobule, which is the real functional unit of liver. Okay, so the branches present, the structures present in the portal triad, they supply the three consecutive lobules. So this consecutive lobule, we call it as portal lobule, which is the true functional unit of the liver. So when we take the section of liver, we can able to, the liver, it is covered by a capsule, and in the capsule we can see the section of the liver. We will able to see hepatic lobules are seen. These hepatic lobules consist of central vein and hepatic cords of cells are seen, nothing but they are closely arranged cords of cells. In between the hepatic cords of cells, we have sinusoids are present. So these, because the blood enters from portal vein, hepatic artery and bile ductule, the secretions from here, they enter into the hepatic sinusoids, and thus liver cells, they are in close contact with the sinusoids, thus able to screen all the substances present in it. And finally here, the portal vein, and from the hepatic artery, the blood drains into central vein, and from the, after screening, the blood drains into central vein, and these central veins together form the hepatic veins. And the hepatic artery, which passes in between the two consecutive hepatic lobules, we call it as portal acinus. And the structures present in the portal triad, they supply the three consecutive hepatic lobules. We call this lobule as the portal lobule, which is the real functional unit of the liver. Okay, and in humans, with the connective tissue septa between the hepatic lobules, it is very ill-defined. We cannot see the definitive connective tissue septa in between the hepatic lobules. Okay, and one more thing is, what is the function of liver is, it helps in the metabolism of carbohydrates, lipids, proteins, everything, and nucleic acids. And one more important thing, it acts as a storage of lipids, amino acids, it has a storage of proteins. Whenever we need glucose, these lipids and amino acids, they are converted into glucose by different cycles are present. And one more thing is, inflammation of the liver, we call it as hepatitis. And in cirrhosis of liver, what happens is, the hepatic cells, they dead in the cirrhosis of liver, and liver in the embryological stage, in the fetal stage, acts as an organ of hemopoiesis. That means it produces RBC. So that's about the liver. And coming to the pancreas. Pancreas is a mixed gland. It consists of both exocrine part as well as the endocrine part. Pancreas, it is a mixed part. It consists of both exocrine part as well as the endocrine part. When we take the section of pancreas, it consists of pancreas, it is covered by a capsule. Various septa, they enter the gland, divides into more number of lobes and lobules. Okay. When we take the section of pancreas, it consists of both exocrine part and endocrine part. The exocrine part, it is similar to the serous salivary gland. We know that the serous salivary gland consists of serous acini, right? So the exocrine part consists of serous acini, compound tubular serous gland. The exocrine part secrete enzymes. The exocrine part in pancreas secrete enzymes. Trypsinogen is there, chymotrypsinogen is there, and it also secretes bicarbonate ion in order to neutralize the acidic action of the stomach. And here the exocrine, I am drawing the exocrine part, nothing but serous acini are present. Very small lumen is pyramidal shaped cells are seen. Nucleus, it is round and situated at the base, and the apex of the cell consists of more number of germogen granules, that is the sector of serous acini. So in the pancreas, the exocrine part consists of serous acini. Coming to the endocrine part, in the endocrine part we will able to see alpha cells, beta cells, as well as delta cells. So exocrine part can be drawn like this: blue dots and red dots. We can draw with blue dots and red dots. Okay. So exocrine part, it is situated in the tail of the pancreas. We know that the pancreas had uncinate process, head, neck, body and tail of the pancreas. So when we take the structure of the pancreas, so this is the uncinate process of the pancreas, this is the head, and this is the neck of the pancreas, body and tail of the pancreas, this is the head of the pancreas, this is the uncinate process of the pancreas. So in the tail of the pancreas you will able to see the endocrine part of the pancreas, that is nothing but the islets of Langerhans. Islets of Langerhans are seen in the endocrine part of the pancreas. Okay, islets of Langerhans. Islets of Langerhans secretes three types of cells: alpha cells, beta cells and delta cells. Okay. So these alpha cells secretes glucagon, which constitute about 20% of the cells of the islets of Langerhans. They secrete glucagon, which increases the glucose level. Beta cells constitute 70% of the total cells of the islets of Langerhans. They secrete insulin, which regulates the glucose level. And coming to the delta cells, they secrete gastrin and somatostatin. They secrete gastrin and somatostatin. This somatostatin hormone, it regulates the action of glucagon as well as the insulin to a lesser extent. So the islets of the endocrine part of pancreas is nothing but the islets of Langerhans, which is situated in the tail of the pancreas and consists of the cells. Three types of cells are present: alpha cells, beta cells and delta cells. Alpha cells constitute 20%, they secrete glucagon. Beta cells constitute 70%, they secrete insulin, and delta cells secrete gastrin and somatostatin. This somatostatin, it regulates the functions of glucagon and also insulin to a lesser extent. So that's about the pancreas. Exocrine part secrete enzymes. We have to represent it similar to that of the serous salivary gland. We have to represent it with serous acini. Some striated, some intercalated ducts are also seen, which are lined by cuboidal epithelium, and also interlobular ducts are also seen, which are lined by columnar epithelium. They are the striated, they are the interlobular ducts. In the connective tissue septa, we can see the interlobular ducts, otherwise called as striated ducts, are seen in the connective tissue septa. So, along with the serous acini in the exocrine part, we will be able to see the intercalated ducts. These are the intercalated ducts. So the secretions from the serous acini, they pour into intercalated ducts. From the intercalated ducts, they pour into intralobular ducts. From the intralobular ducts, they pour into interlobular ducts. From the interlobular ducts, together forms the pancreatic duct. And the endocrine part consists of alpha, beta and delta cells, and the hormones are the glucagon, insulin and somatostatin and gastrin respectively. So that's about the pancreas.